This video is about addressing dark circles around the eyes, a comprehensive approach. Dark circles around the eyes, often accompanied by puffiness or discoloration, are a common concern for many individuals. These under-eye shadows can be caused by various factors, including genetics, age, lifestyle, or underlying health conditions. While completely getting rid of dark circles may not always be feasible, managing and reducing their appearance is achievable through a multifaceted approach. This video explores effective strategies to address and minimize dark circles, allowing individuals to embrace a more refreshed and vibrant appearance. Understanding the causes. Before delving into remedies, understanding the root causes of dark circles is crucial. Factors such as genetics, thinning skin due to aging, allergies, lack of sleep, dehydration, sun exposure, and lifestyle habits like smoking or excessive alcohol consumption can contribute to their prominence. Identifying the underlying cause can guide targeted solutions for each individual. Skin care regimen. A well-rounded skincare routine can significantly diminish the appearance of dark circles. Gentle cleansing, followed by the application of eye creams containing ingredients like vitamin C, retinol, hyaluronic acid, or peptides, can help hydrate the delicate skin around the eyes, improve collagen production, and reduce discoloration over time. Using cold compresses or chilled eye masks can also alleviate puffiness and reduce the appearance of dark circles by constricting blood vessels. Healthy lifestyle habits. Simple lipstick modifications can make a considerable difference in reducing dark circles. Prioritizing adequate sleep, aiming for 7 to 9 hours per night, promotes skin rejuvenation and reduces inner-eye puffiness. Hydration is key. Drinking plenty of water helps maintain skin elasticity and minimizes the appearance of dark circles caused by dehydration. Avoiding excessive alcohol consumption and quitting smoking can also improve skin health, reducing the prominence of dark circles. Balanced diet. A nutrient-rich diet plays a pivotal role in skin health. Consuming foods high in antioxidants, such as fruits, vegetables, nuts, and seeds, helps combat free radicals and support skin regeneration. Additionally, foods rich in vitamin K, like leafy greens, can aid in reducing dark circles by strengthening blood vessels and minimizing blood pooling beneath the eyes. Sun protection. Shielding delicate skin around the eyes from harmful UV rays is essential. Regular use of sunscreen and wearing sunglasses with UV protection not only prevents further skin damage, but also aids in minimizing dark circles caused by sun exposure. Allergy management. Allergies, particularly seasonal allergies, can exacerbate under-eye discoloration and puffiness. Managing allergies through antihistamines or allergist-specific treatments prescribed by a healthcare professional can help alleviate these symptoms and reduce the prominence of dark circles. Medical treatments and procedures. In cases where dark circles persist despite lifestyle modifications and skincare routines, medical interventions may be considered. Dermatological treatments such as chemical peels, laser therapy, or microneedling can stimulate collagen production and reduce pigmentation. Additionally, dermal fillers or platelet-rich plasma PRP injections can be used to improve volume and texture, diminishing the appearance of dark circles. Cosmetic camouflage techniques. Cosmetic solutions like makeup and concealers offer immediate camouflage for dark circles. Choosing concealers with yellow or peach undertones can neutralize discoloration, while applying a color corrector can counteract purple or blue tones. Using makeup techniques to highlight other facial features can also draw attention away from under-eye shadows. In conclusion, addressing dark circles around the eyes requires a comprehensive approach that combines skincare, lifestyle adjustments, and, in some cases, medical intervention. While completely eradicating dark circles may not be feasible, managing their appearance is achievable through consistent skincare routines, healthy lifestyle habits, sun protection, allergy management, and, if necessary, seeking professional treatments. Embracing these strategies can empower individuals to diminish the prominence of dark circles, allowing them to present a more refreshed and vibrant appearance that reflects their overall well-being and vitality.